a briefing in person tomorrow, although at 3 o'clock there will be a daily update for everyone that will be posted. And then Dr. Henry will be briefing on Saturday right here at noon. And with that, I'd like to introduce, it's 1 o'clock already. Let me repeat that then. Dr. Henry will be briefing at 1 o'clock on Saturday on the Victoria Day weekend. And I want to introduce Dr. Bonnie Henry.
Thank you very much. Good afternoon. So today we have an additional 15 new people who have tested positive for COVID-19 in British Columbia, bringing our total to 2,392 people who have tested positive in the province. That includes 878 in the Vancouver Coastal Health Region, 1,149 in the Fraser Health Region, 126 people on Vancouver Island Health Region, 181 people in the Interior Health Region, and 58 people in Northern Health. We continue to have active outbreaks in our healthcare system, including 15 in long-term care and assisted living and 4 in acute care, although today one of our outbreaks has been declared over, and that's at the MSA Rehab Unit, or the Worthington Pavilion in Fraser Health. We have now 500 cases related to those outbreaks in our healthcare system, including 309 residents who have tested positive and 191 staff. We have no new community outbreaks to report, and the number that we're dealing with continue to be managed, although it's good news again, the Superior Poultry order that required that facility to close has been rescinded, and the plant has reopened with health and safety protocols in place to protect the workers in that plant. So we now have 372 active cases in the province, across the province, and of those we have 58 people who are in hospital and 12 now in critical care or ICU. We have, unfortunately, an additional 3 deaths to report today, bringing our total number of people who have died from COVID-19 in British Columbia to 135. And our condolences go to the families of the people who have been affected again with this disease. We have 1,885 people who have tested positive who've now fully recovered. As people are aware, we are coming up to our phase 2, and with our continued low level of transmission in the community, we need to be cautious and careful as we're moving into the next phase of our outbreak, our pandemic here in British Columbia. And I wanted to talk a little bit about how we will be monitoring that. We will be watching very carefully, and we've talked about the need to be thoughtful and slow, and part of our role in public health will be monitoring the number of new cases, and in particular numbers of people who aren't linked to known cases or outbreaks in our community, and that will be very important. And we will be progressing slowly. As we know, the incubation period for this virus is 14 days. So it will take us the next 14 to 28 days to understand the impact of the measures that we're taking in the coming week. So I want that as a caution for people to know that we will not be moving into the next phase until we are confident that the measures we've taken so far have not resulted in a dramatic increase or dramatic increase in transmission in the community. So those are things we'll be watching carefully in the coming weeks. I did want to say as well, thank you to everyone who has completed the province-wide Your Story, Our Future survey. As of this morning, more than 165,000 people so far have taken the survey, and I encourage you to continue to spread the word to friends and family. We need people who are younger and older and from all parts of the province to tell us your story and the impact that this pandemic has had on you. As you know, the survey is available at the BC CDC website at bccdc.ca /COVID-19 survey, or you can call 1-833-707-1900 to take the survey over the phone. And pass the links on to your families and friends. So yesterday I presented a few scenarios of some of the things we needed to think about around social interactions as we move into phase 2. And I want us all to be thinking very carefully about our own situations and thinking about smaller groups, fewer faces, less time in close contact together, and bigger spaces, particularly as we go into this weekend. I also want to talk today a little bit about travel. As we know, lots of people have questions about travel and about when and where we can do things. Many of us want to plan our summer activities right now or well in advance. But this year, with the risks that we continue to have in our communities across this province of COVID-19, we need to look at plans in a much narrower frame. So we need to think just a couple of weeks ahead versus a couple of months. And things will become clearer in the next 14, 28 days. And then we will be able to expand our advice and expand our thinking about what we can do in the coming days. We have to continue to take it slow. This weekend, less travel is incredibly important. We're asking that of everyone, whether in your car, on a boat, or even by foot. There are many activities and places that we can go safely and safely enjoy close to home. Rain or shine, we can get outside and enjoy some of the best of BC right in our own backyards. And top of mind for all of us needs to be fewer faces, smaller groups, shorter times together, and bigger spaces. Go for a hike in your local park. Visit the farmers markets, which have started up on the weekends. Have a picnic. And if the rain sets in, continue to do those things that we have been doing. Have a weekend of movies at home. Have those Zoom dates, those Zoom parties. Be aware of those around you and continue to be considerate and to keep them safe too. Let's use this May long weekend as an opportunity to everybody to put our safe social interaction rules into action so that we know what we can do and we start those habits for the coming weeks. Your path ahead is based on your personal circumstances, and your safety and those of your family and your community is based on your actions. There are a few situations that I know that have come up in many occasions. One of them is somebody who works away from home and is coming back either for a weekend or for their transition. There's nothing like seeing the faces of your family and friends in your home. But you need to be extra cautious about who you see outside of your household bubble if you're coming from another place back into your community. We need to minimize the potential for this virus to move between communities as you travel back and forth. And we have seen that. We've seen that with people who are essential workers, who work in other, sometimes other provinces, and even in other countries. We need you to stay close to home, particularly now as people are expanding their social networks. We need you to be very mindful that you have come from a place where there may be a different risk, and we need to be careful about that when you come back to BC. I know some people have relatives as well in other parts of the province, and people you were worried about may have been alone for some time. Social connection is so vital to our emotional health and to our social health. If they are older, however, think very carefully about how your visit may increase their risks. If you have been staying close to home and not having those social contacts for at least a couple of weeks so that your risk is low, then you may go. If you have been socializing with others, then maybe you want to wait until you've had a period of time that you know is safe before you go. And if you're planning on visiting a relative or a friend or somebody who has been alone for this period of time, and you have been socializing in the next couple of days, then take that time before you go to visit somebody who may be at risk. Remember, when you do visit others, everyone that is in your expanded household, your bubble, is coming along with you, and that risk comes with you too. Seeing friends is really important for all of us, and I know particularly for our young people who have been stuck at home, sometimes with family members for a long time. But traveling with friends is not what we need to do right now, unless they are people who have been included in your household circle for the last few weeks. If they are part of your newly expanded circle in the coming weeks, have a conversation in advance about how you will stay apart or stay together and be your own circle together, not having multiple different people that you're connecting with, because that puts you all at increased risk. So separate spaces and getting together outside, as we know, is far safer than congregating together inside. So think about that as well when you're meeting up with people once we move into phase 2. So for many of us, this May long weekend is the unofficial start to summer. And today, this summer, is going to be somewhat different for all of us. And this is our chance to start focusing on enjoying the many wonders that we have within our province. And many of us, that steps away from where we are. And this weekend, stay close to home. Let's make this our summer of care and consideration for our families, our communities, and our province. It'd be a summer for us all to remember to be kind and to be calm and to be safe.
Thank you very much, Dr. Henry, and I wanted to also pass on my condolences, those of the Premier and the government, and I think people in BC, to the 3 people who have passed away, all in Fraser Health in the last 24 hours from COVID-19. It is, I think, as we've said before, but it's important to recognize the toll that COVID-19 has taken on people of BC in every way, but in particular, those who had a family member pass away. We want to express our condolences at this time of grief and say that they will not be forgotten. They're certainly not forgotten by anyone in BC, and we hope as communities to continue to support people as they go through this difficult period. I wanted to note that of course, we had 15 more cases today of COVID-19. That COVID-19 continues to be present in all health authorities in the province. We have 58 cases of people who are hospitalized at the moment, and that's 33 in Fraser Health, 1 in Interior Health, 1 on Vancouver Island, 2 in Northern Health, and 21 in Vancouver Coastal Health, and 12 people in critical care. And so what that indicates is, again, that number is continuing to slowly come down, and broadly we see that as a positive thing. We should note that the number of people, the occupancy rate in our hospitals has continued to go up again slightly, indicating increased utilization of healthcare services for reasons other than COVID-19. We've seen that in recent days in emergency room numbers, and today occupancy rates across BC hospitals are 67.1%, and in critical care at 52.3%, indicating a rise in both, if slight, in the case of hospitalizations. This is different in different parts of the province. I'd say overall hospitalization occupancy is higher now on Vancouver Island than in other places, but that continues to grow. I want to join Dr. Henry in saying that 165,000 surveys is extraordinary, and it indicates, I think, the commitment of people in BC to supporting this effort, to doing what they can in every way to support this effort to fight COVID-19. And we encourage people, let me get this right, www.bccdc.ca/COVID-19 survey. And please consider filling it out, helping other people fill it out so that we can get the maximum amount of information necessary to guide us through the coming weeks and months and year. I want to give an update with respect to surgery. Yesterday I gave you an update with respect to the numbers of surgeries that had taken place since March the 16th, since the decision to cancel and delay scheduled surgeries, elective surgeries in the province. Since May 7th, when we announced that we would be resuming scheduled surgeries, staff of the health authorities have been busy connecting with people who have had their surgeries delayed, and to date, since that time, 6,884 people across BC have been contacted by staff to discuss the rescheduling of surgeries and to discuss where they are and what they would like to do with respect to their surgeries. And that work, that was as of yesterday, that work is continuing and accelerating every day. On Thursdays, we're giving regular updates on the single site proposal as to where we are. This is a proposal that will have employees in long-term care, assisted living, private hospitals, standalone extended care hospitals, and provincial mental health facilities restricted to working at a single site. We started with 545 facilities hosting multiple facility employees, with a total of 7,350 employees who worked at multiple facilities. Here's where we are right now. Of those 545 facilities, 495 have completed their single site plan. That's an increase of 130 sites from the 365 reported last week. That's 122 in Interior Health, 136 in Fraser Health, including 2 Provincial Health Services Authority sites, 96 in Vancouver Coastal Health, including 6 Providence Healthcare sites, 106 in Island Health, and 35 in Northern Health. The number of site plans announced there are the ones that are completed, and we will continue. We are obviously making progress on some more, and we'll have more to update you on every Thursday on this question. I think it's important to recognize just the extraordinary work that's happening in long-term care, and that there are more people working as care aides everywhere across the province. We have, amongst care aides, 1,080 additional healthcare assistant care aide registrants in our province full-time and 188 part-time, and they're making an extraordinary contribution. I think what's clear is the care provided particularly directly to residents in long-term care and to people in acute care by care aides is something that we recognize every day. Many of them members of the hospital employees unions and other unions who do extraordinary work, and we are grateful for those who have joined this effort to serve people at this most difficult moment. I was asked yesterday about the cost of the proposal, and I just want to make some further points just to signify what's happening, because while employees have not yet received an increase in their hourly wages to level up to union wages in accordance with the terms of the single site staffing framework, work is underway to guide wage leveling, disperse funding, and monitor commitments and expenditure. Health has been working, the Ministry of Health has been working with health authorities to gather detailed information from non-HEABC sites, that's non-Health Employer Association of BC sites, on current compensation provided to each assisted living and long-term care staff member. This is, of course, a time-consuming and somewhat complex task, as there are many collective agreements in healthcare, and some, indeed, such facilities that do not have collective agreements at all. Health has not had insight into the actual wage and benefit costs at many of the private locations and some not-for-profit locations up to now. To support this work, the Ministry of Health has worked with legal services, health authorities, and industry partners to develop a provincial template and process. Once all of the information is received, Health will be analyzing the information with health authorities and developing the funding mechanisms to distribute the funding to HAs, which are health authorities. Health authorities will then provide the funding to the service providers and work with them to ensure that all the funding flows to frontline staff. Given the need to develop a mechanism, and this is a slight delay, to collect the necessary individual employee wage information, funding is now expected to flow in early to mid-June, but will be retroactive, as you would expect. And I just want to note on the question of the overall cost, obviously this analysis will continue, and we'll continue to report on those questions in detail. I said when we announced that we were doing this that it would be approximately $10 million a month, but of course we'll be providing the detailed information once we finish the analysis on contracts across BC. So next week, of course, we move to the phase 2 of the BC restart plan, and we have to make it a strong start, not a false start. We know that it takes about 2 weeks for the virus to incubate and to show up. That's what Dr. Henry has said. So this weekend, let's make sure that we're all using what we've been taught to stop the spread. That's physical distancing. That's regular hand washing. That's sneezing and coughing into our sleeves. That's avoiding gatherings with people outside of our bubble. That's staying at home when we're sick, and no to non-essential travel. That means if you can, Avoid going to places such as the Sunshine Coast, to Powell River, and to Seashell, to Gibsons, and to Pender Harbor, as wonderful as all of those communities are, for example, that this is not the weekend to go. We need to stay close to home and hopefully enjoy the beautiful weather, or even maybe the little bit rainy weather that may come with the Victoria Day long weekend. This weekend, the best place to be in BC is right where we live. We are at a good place because people have been 100% committed up to now. In BC, we bend the curve, not the rules, and that makes all the difference. And it needs to make the difference this weekend too. If a park is reopening close to home in our community, let's add that to the things we can do safely this weekend. But let's stay local, stay apart, and stay safe. That way, as we launch phase 2 and pursue the opportunity it holds for surgical and social and economic renewal, we can do so confident in our commitment to our joint effort. Confidence that we've done everything we can this weekend to stop the spread, to reduce hospitalizations, and to give ourselves every chance of success in the weeks to come. So to everyone, have a great long weekend. Stay local, stay apart, stay safe, and stay 100% all in to stop the spread. Aujourd'hui, nous annonçons 15 nouveaux cas pour un total de 2392 cas de COVID-19 en Colombie-Britannique. Nous sommes attristés d'annoncer 3 nouveaux décès liés au COVID-19 dans la région de santé de Fraser pour un total de 135 décès en Colombie-Britannique. Nous offrons nos condoléances à la famille, aux amis et aux aides-soignants de ces personnes, ainsi que tous ceux qui ont perdu leurs proches. Parmi l'ensemble des cas confirmés de COVID-19, 58 personnes sont actuellement hospitalisées, dont 12 en soins intensifs. Les autres personnes dont le test de dépistage a été positif sont en isolement à leur domicile. J'aimerais fournir notre 3e mise à jour sur la proposition de site unique. Cette proposition prévoit que les employés des soins de longue durée de la vie assistée des hôpitaux privés, des hôpitaux autonomes de soins prolongés et des établissements provinciaux de santé mentale ne pourront travailler que sur un seul site. Nous avons commencé avec 545 établissements qui comptent des employés dans des établissements multiples, avec un total de 7350 employés qui travaillent dans plusieurs établissements. Voilà où nous en sommes en ce moment. Sur ces 545 installations, 495 ont achevé leur plan de site unique. Cela représente une augmentation de 130 sites par rapport aux 365 signalés la semaine dernière. Il s'agit d'un changement complexe et nécessaire dans notre approche des soins et je tiens à remercier tous les personnels impliqués dans l'effort. Merci beaucoup. Thank you very much, and we're happy to take your questions.
Thank you. As a reminder to everybody on the phone line, please press star 1 to enter the queue. You will be limited to 1 question. Please also unmute your phones. You will not be audible until I call your name. First question is from Hina Alam, Canadian Press.
Hi, Dr. Henry. I hope you're doing okay. I was looking at the WHO report, which said that COVID-19 is going to be around for a while. And with the reopening plan, I was wondering if you had any comments about transportation, because most people would be worried about getting into a train or a bus, which is usually packed cheek to jowl, and germs can transmit pretty easily. So do you have anything to say about that? And also, do you anticipate another shutdown or lockdown like this one, or maybe stricter if we see a spike in cases in the fall or after things begin to reopen? Thanks, Dr. Henry.
Thanks. And yes, I am aware. Dr. Mike Ryan is actually a colleague and a friend of mine. And yes, he was talking about the concerns that we all have, that we don't yet know how this virus is going to behave in the future. And there is a possibility, depending on how long immunity to it lasts, there's a possibility that it will actually continue to circulate for many years. And so that is something that is of top of mind for many of us. And we've talked a number of times about the importance of serology testing, about understanding the what immunity means, how antibodies protect us, and for how long antibodies protect us. So we don't yet know that. And I think that it also highlights the importance of an effective vaccine in helping us manage this in a long-term way. In terms of transportation, public transportation, yes, obviously we are concerned, and we have been working with the Ministry of Transportation Infrastructure and TransLink across BC, transportation structures across BC, because we do need to continue to put in those distancing measures that protect us in our public transit system. As you know, public transit has been open and running throughout this whole phase one that we've been through our pandemic so far, because it is an essential service for many people. It is their means of getting to work, and we need to continue that. So yes, we are working through this next phase to make sure we have the right things in place to protect people who work in the transit system and to ensure we can continue those distancing measures that protect people who take public transit. So you won't be seeing those packed cars, either buses or subway cars, in the near future. And we're also looking at, what is the place for other things like short-term wearing of non-medical masks in the transit system. And that is certainly an option for people even now. The other thing that I would like to look at and encourage is people finding active transport ways to work. So whether that's walking or running or biking, those are the things that we need to also encourage in the coming weeks and months as ways that we can protect ourselves and stay safe, and also get in some exercise along the way. So I think this is an opportunity to look at how we can restructure some things in our communities to make biking and walking and to work active transport to work more effective and easier for people. And the final one was around whether we're going to see an increase in the fall. And I think that's something that, again, we're going to wait and see. We're taking this phase slowly, as we've been talking about a number of times. Although it starts on Tuesday, I do not expect that everything is going to be open. And it certainly is not going to be open in the same way that it was in December, for example. We have guidelines. WorkSafe BC has been working on them for different sectors, along with my colleagues in public health, to make sure that we continue to have the important measures in place that stop the transmission of this virus, or give us the best chance of that. And that includes keeping safe distances, reducing the number of people who are in a place at a one time, making sure that we can safely move through a retail center, for example, or in our office, having fewer people in, making sure we have the ability to clean our hands regularly, making sure we have the ability to clean high-touch places in our workplace and in our environment. So those things will be in place, and we'll be watching over the coming weeks.
Next question is from Shannon Patterson, CTV.
Oh, hi, Dr. Henry. We're hearing a lot more this week about this potentially deadly Kawasaki-like illness in children that appears to be linked to COVID-19. What's your level of concern about this here in BC, and does it factor at all into the decision to reopen schools here?
Yeah, so Kawasaki syndrome is something that we've known of for a long time, and it has been associated with other viral and bacterial infections, and it tends to come after a child is infected. It seems to be mostly in children, and mostly in younger children, so younger than school-age children. So with COVID-19, we are seeing some associations, mostly with children who are slightly older. Particularly in New York, they've reported on about 100 cases, including 3 deaths. There's been smaller numbers reported out of the UK and also in parts of China, though mostly we're seeing it reported out of Europe. Again, not everybody who has Kawasaki syndrome symptoms is associated with COVID-19, so we're still not clear what the relationship is, but that is certainly an area of ongoing investigation. And here in BC, the Canadian Pediatric Society and our Children's Hospital has been watching very carefully all of our children, young people who have COVID-19, and we've been monitoring this as part of an ongoing national and international approach here in Canada. We have not had any children yet in British Columbia who have experienced this syndrome. There have been a small number that may be related in Montreal that we've heard about. So yes, we are watching it. It is still very rare. And it is still something that that pediatricians and clinicians know what to look for, and parents need to be aware of it as well. In terms of children being affected, we do still know, and the evidence continues to accumulate, that children are less likely to get infected with the COVID-19 and less likely to have severe symptoms. So while it is potentially associated with it, it's still a very unusual event and a rare event in terms of the overall impact of the pandemic. So it is something that we'll be watching for in children of all ages, and certainly something that we'll be watching for if any symptoms arise in children in school-age children.
Richard Zisman, Global News.
Dr. Henry, thank you so much for taking my question. An outbreak at the Langley Lodge long-term care home was declared over by the province back in April. On the 29th of April, it was moved back into the active case list, and as of today now, there's been 20 cases and 2 deaths there. Can you explain how it happened weeks after the LTC order was put in place?
Yeah, so the initial outbreak was declared when there was a single staff person who was identified, and there was no additional cases in the outbreak period related to that person, so the lodge was deemed out of outbreak, and then unfortunately there has been another introduction, and that's where the outbreak was declared again. So it was not related to the initial one, and the investigation continues to try and determine how it came in. But this is the challenge that we have, and one of the reasons why we've put in place this provisions around people not working in more than one place. It's very challenging, and it continues to be challenging to manage this virus when it gets into a long-term care home.
Next question is Briar Stewart, CBC.
Yes, Dr. Henry, I'm wondering if you could give us details on the province's surveillance program, particularly as restrictions begin to ease. We know there's been a focus in long-term care facilities, but I'm wondering about other high-dense areas where there's a vulnerable population like shelters. Is there going to be random testing and sampling? And I'm also wondering if you're satisfied with the level and speed of contact tracing in the province. And when you're done answering, if I could get Minister Dix to respond in French as well, that'd be appreciated.
Sure. I'll talk slowly. So, yeah. We are continuing. As you know, our capacity for testing is about 7,000 tests a day now in various parts of the province, and we have been only doing about 2,000 tests. So our testing strategy and our surveillance strategy are aligned with trying to make sure we detect anybody in the community that has symptoms of COVID-19, and so it is available to anybody with symptoms who are assessed and then can be tested. And yes, that is what we want to do right now, is pick up cases. There is limited value in doing random testing of people with no symptoms and no contacts that are of concern in the community. So and we're talking about the diagnostic test, the NAT test, the one where we do the swab in the nose. So we are doing testing of asymptomatic people when they're associated with a case. So, for example, we tested everybody in the federal correctional facility, the Mission Correctional Facility, because we knew there was transmission going on there, and there was a probability that people who were there had been exposed to the virus and may have been early on in the symptoms or incubating it and not yet showing symptoms. So testing is important in those situations. We do testing as well with a very low threshold in our long-term care facilities to identify anybody who might have the virus. So those, and also if we have a case that comes in the community, and we look at the poultry industry cases, for example, the initial person who tested positive was a case that arose, an unlinked case in the community. So we tested their family, and then we went into the workplace and tested people there. So if we think of it and part of this is because of the test is not as sensitive as it's not 100%, so it misses some cases, particularly early on in the illness. You can test negative when you might actually be incubating the disease still. And it does have a small but real a false positive rate for a variety of reasons. And so doing random testing of people in the population, I think a good example is in Wuhan, where they say they're going to test 11 million people in 10 days. And so we know the prevalence, the number of people who actually have this virus is very low in Wuhan right now. So if we test 11 million people, even if the test is 99.9% sensitive and specific, we're going to miss hundreds of people who actually have the disease. And we're going to tell hundreds and probably thousands of people who don't have the disease that they've tested positive. So it's a challenging thing, and it's a limitation of the tests that we have right now. So we are doing some very sensitive testing and surveillance. We automatically test anybody who has a respiratory illness swab sent in for COVID-19 as well, and we will continue to do that, and we'll be transitioning our strategy as we move into the viruses. But the other part of it, as you mentioned, is how important it is for us to be able to do case management, we call it, so investigation of every single person who tests positive and tracking all of the people they've come in contact with and testing them and making sure that they are in isolation if they're able to first determine every single person. And part of the things that we'll be watching over the coming weeks and months is being able to connect with every case within 24 hours, within a day, 1 to 2 days, to make sure and to have complete all of the contact tracing. So the completeness of how many people we're able to find who they had contact with is a really important measure as well. So those are some of the things we'll be watching. And yes, we will be beefing up over the summer if things continue to stay relatively low in preparation for the fall, because we know it will become more complex once we have other respiratory viruses as well. So sorry, that's a little bit lengthy.
Après aujourd'hui, personne ne va m'embaucher comme traducteur. De toute façon, il faut dire que nous avons maintenant et nous allons continuer à augmenter notre capacité de faire des tests ici en Colombie-Britannique. Notre capacité quotidienne, c'est à peu près 7 à 8 000 actuellement. Et nous faisons à peu près 2000 tests par jour actuellement. Donc, il y a beaucoup de capacité. Et ça ne fait pas beaucoup de sens de faire des tests sur des gens qui n'ont pas de symptômes. Donc, nous sommes en train de faire des tests sur tout le monde qui a des symptômes, même des symptômes mineurs. Donc, on continuera à faire cela. Il faut dire qu'on a changé notre stratégie depuis le commencement, notre stratégie de faire des tests ici depuis le commencement, et on va continuer de le faire. Il faut continuer à augmenter notre capacité de faire des tests quotidiens pour qu'on puisse être prêt pour ce qui va se passer au printemps, en automne. Donc, ça continue, nos efforts continuent. Mais l'idée de surveillance dans une communauté, l'idée de faire cela, de faire de la surveillance dans une communauté avec des tests sur ceux qui n'ont pas de symptômes, ne fait pas de sens parce que il y a beaucoup de tests qui franchement, il y a des faux négatifs, soit des faux négatifs, soit des faux positifs. Donc, on continue avec notre stratégie. On voit à Wuhan, par exemple, un effort de faire des tests sur 11 millions de personnes. Mais s'il n'y a même pas une erreur de 0,1% des gens, ça fait quand même beaucoup d'erreurs. Donc, il faut continuer avec une stratégie fondée sur la science. C'est ça qu'on va continuer à faire. Et c'est cette stratégie définie par le Dr. Henry, définie par le BC Center for Disease Control, qui va nous mettre sur la bonne voie. Cela nous a mis sur la bonne voie depuis des mois et ça va nous mettre sur la bonne voie dans les mois à venir.
Next question is from Cindy Harnett, Times Colonist.
Hi, Minister. Well done, I must say. I wonder if are there some more details that you can give us on the rebooking of surgeries? Do you know that many are booked already to go next week? Is there any kind of breakdown of the 6,800 people who were called in terms of regions or a percentage who have declined because of the pandemic? And what would you say to those who have not been called yet? And they're anxious about rebooking.
But they'll be called, and I'll just give you, for the moment, Cindy, the breakdown by health authorities. So that's 785 in Interior Health, 250 in Fraser Health, where they started later, 2,034 in Vancouver Coastal Health, 1,163 in the Vancouver Island Health Authority, 406 in the Northern Health Authority, and pretty much the full number, 2,246, in the Provincial Health Services Authority. So that's the breakdown right now, but it's happening, it's going on, and we'll have more to say in the coming days. But what we wanted to do first is to touch base with everybody to make sure that that they were comfortable. I think it's fair to say, and this is not detail, but qualitative, that there are some people who have apprehension about going into hospital right now. I think it's fair to say that that apprehension is less in some places, probably in some places where there's been less COVID-19 than others. For example, on Vancouver Island right now, we're much closer to full capacity in our hospitals, much closer to where we were in terms of ER visits to what it was before COVID-19 than in other regions. That is partly due to issues in some hospitals around ALC beds, for example, in the North Island. So on Vancouver Island, they're making some progress, and we'll keep reporting on it, but those are the detailed health authority breakdowns.
Next question is from Marcella Bernardo, News 1130.
Thank you. I think this is for both of you, but just looking ahead into all of the confusion about what's actually happening next week, do you regret the way this reopening has been rolled out, considering how many people have jumped to the conclusion it's safe to start up again right on Tuesday?
Yeah. I don't know if we can regret something that has not yet happened, but no, this is, we're not going to get everything perfect, and that has been our, that has been my burden to bear from the very beginning. We do the best that we can. We've never done this before around the world. We're watching what others are doing. We're trying to learn from that. We're trying to take things slow and thoughtful, and it takes time for those things to come together. And I actually do feel that most people are saying, okay, the green light, it's kind of like a dimmer switch, right? It's getting brighter on Tuesday, and people are taking their time to look at their own circumstance, particularly businesses and the ones that I have talked to. Some are very, of course, eager to go. Others are very concerned about it, and it has a lot to do with their own physical setup, with the people who are working in their business, as well as the customers they're serving. So I think it's going to be something that we're going to have to work through together, starting next week, and we're just going to have to take it slowly and to err on the side of caution as best we can, because what we really need to do is make sure we have things in place that are safe for our employees, safe for our customers, and so that we can all be confident that we're doing the right thing and that we're going to get through it. And it's going to take some time. We know that WorkSafe is working hard on the employee part of it. Our public health teams are working hard on making sure the public is safe, and we'll see how things go in the next week and coming weeks.
No, I think that the approach has been from the beginning to be prudent, to take time. So the announcement was made last week. We're not proceeding to phase 2 until next week. People are, I think, justifiably taking their time. We have never done this before. We've never been this constrained, and we've never come out of a period of such constraint. And so this is going to be a challenging time, and people are right to be cautious, and we want them to be cautious in this period. And we're still right now in phase 1, and so The downside, you might say, in telling people phase 2 is coming is that there may be confusion about that amongst some people, but I don't think amongst most people. 2 days ago, we said there was a survey we needed people to fill out. And I think by the time we finished the press conference and walked back to the Minister of Health's office here in the legislature, thousands of people had already filled it out. People want to do the right thing. Overwhelmingly, they are doing the right thing. This is a new thing we're doing, and it's going to require us to do that for the months to come. And in some ways, this next period is going to be more difficult to execute than the period we've just been in, because we're going to be out more in our workplaces and other things, and we have to ensure that physical distancing continues to happen, because physical distancing stops the spread, physical distancing saves lives. So our message, my message, Dr. Henry's message is going to be consistent about what people need to do. But when we learn things, we're also going to adapt. And that's what's going on right now. So I feel good about it. I'm very proud of the people of BC. I can't tell you how inspiring it is to see people come together, not just for themselves, but for their families, for their loved ones, and for their communities. And I think that's happening now, and that's going to continue to happen. And we really need to continue to be with each other, because our success in restarting surgeries, our success in restarting important services in our community, our success in restarting the economy, those parts of the economy that haven't been going, will continue to depend on people following Dr. Henry's advice and guidance and instructions. We have to continue to do that. That hasn't changed. It won't change next week. It won't change the week after that. It won't change in July. We have to continue to stay the course.
Next question is from Vaughn Palmer, Vancouver Sun.
Good day, Dr. Henry. A story out of Spain, antibody study by Health Institute in Madrid and the National Statistics Institute suggests that about 5% of the Spanish population has contracted the virus, which would be about 10 times the national count. It's the second or third time we've seen that range of numbers in antibody studies. Do you think it's plausible that it would be that level? And if it is, what would be the implications for British Columbia going forward?
Yeah, so the challenge that we have in every country that's done this work has had is the errors in the test. And so we've seen that we now have two serology tests that have been approved for use by Health Canada. And here in BC, I've told you we're working on validating the test that we want to use to do that very type of study, to look at what percentage of our population. And so that study in Spain, along with there's one from the UK, there's a couple of them that are out there, has a range. But it is, it could be, particularly in some areas of Spain, I could see that, 3, 4, 5% of the population could have antibodies to this. I suspect we might be slightly lower here in British Columbia. It may be higher in Montreal. But I think the important thing to realize is, there is a range. So it's maybe somewhere around there. And that would not be out of expectations for here as well. That's nowhere near what we need in our population to have community immunity to prevent the transmission of this virus. So, that's an important consideration as well. And we look at what happened in Spain and the rapid increase of numbers of cases and the deaths that they had there. We may have a smaller proportion of our population, but it's spread out over time. And we, thankfully, because of the work that people did here in BC and the way we responded to this, we have not had those dramatic spikes that overwhelmed our healthcare system. So, yeah, we'll wait and see. We are quite anxious to get our serology studies off the ground. The one that I told you about where we've banked blood samples from March, actually from earlier in the year, just before we started to see cases here in BC. We'll be taking the second set of samples starting next week. And once the test has been fully validated, we understand the false positives and the false negatives and the rate, then we'll be doing a very similar study here.
Okay, we have time for one more question this afternoon. For anyone that did not get to ask a question, there will be a statement released later on today. For recommendations on protecting families and communities from COVID-19, visit bccdc.ca. For non-medical questions about the province's COVID-19 response, visit gov.bc.ca/COVID-19. And for a full listing of the Provincial Health Officer's orders, visit gov.bc.ca/PHO guidance. Last question is from Farhan Mohammed, Daily Hive.
Good afternoon. Talking about how we won't see results of measures being implemented for another 14 to 28 days, does the province have an adjusted plan for phase 2 if things over the next few weeks get worse? Like, could we see some sort of phase 2 measures being scaled back? And also want to know how your own mental health is during this time and what you're doing to get through each day.
So yes, we have put a proposal for the next phase and for the things that we'll be considering in the next phase. But those are all contingent on watching what's happening. And that's why we keep talking about, we need to go slow, we need to be thoughtful. We'll be developing, now that we have the process in place with WorkSafe and public health working together with different sectors in industry, we'll be starting to look over the next couple of weeks of how we can support the different groups that we've talked about that will be coming in the next phase 3. But the exact timing of that has intentionally been left blank because it will so much depend on how things go in the coming 2 to 4 weeks. So yes, we'll be planning for it, and yes, we'll be adjusting and adapting as we go forward and as we see what happens in terms of the spread of this virus. In terms of my own mental health, it's been a challenging few months, let's just say. But I am somebody who runs and meditates, and I am very grateful and thankful that I have a huge team of health and public health professionals that I work very closely with, and that is what keeps us going. And that and understanding the impact that this virus has on our communities and the measures that we have put in place and how hard it has been for many, many people. So trying to find those important pieces, moments of joy in our day is incredibly important. And when I think about the young people in my life and I think about the elders in my life and my community, those are the things that keep us. And I know it's the same for many people here in BC. It's thinking about those people who bring us joy in our life that keeps us going through this, and that's what will get us through this together. Thank you.
That's all the time we have. Thank you.